At Avon HMO, our mission is to empower people to live healthier, fuller lives. And when we say people, we mean everybody, because we believe that no matter what income level or social status a person belongs to, they should be able to have access to healthcare services without any form of financial strain and without a fear of incurring catastrophic healthcare costs.
From our own assessment, the benefits have been tremendous. I mean, it's been a very welcome development. In fact, I would say that the community was looking forward to this because a lot of groundwork was done by SNEPCO before it took off. And so it was welcome. And a lot of people are happy with it and they are benefiting from it.
See for yourself the impact that Avon HMO is having on the inhabitants of Idemili and its surrounding communities.
Avon HMO scheme was announced in my church during service. So we were told about the importance of registering with the scheme and the benefits people do get from it. So I decided to come and register.
I was admitted here, Messia, now I check up. But it didn't check up, I was in my Avon. So they say Avon now, the good. What is that?
The fundamental issue, like most insurance businesses, is awareness, is creating awareness, making sure that people understand. And BOT has gone out to do this, sensitizing people, and actually making sure that from the delivery of the health services that things are actually working, and capitalizing on the fact that people give their positive results about what they see, and that has helped the scheme to grow.
I was excited when I was looking well, register 12,000. Wherever I had Avon number 1 to register. Immediately, I started benefiting.
I registered sometime in December last year, and I got my identity card almost immediately, like 2 weeks after registration and everything. The services began.
When we as Avon HMO engage with communities or corporate bodies or groups of people, our goal is to improve key healthcare indices that brings our mission to life in a very impactful and measurable manner.
My experience in the hospital as an Avon member has been very, very good so far. Everything, every charges about the antenatal was done free. Even the registration, the lab things, even obtaining my drugs from the pharmacy, everything was very free. So the services were so far good.
In terms of cost, it has helped me immensely. I pay, formally, I pay for the drug, whole entire, whatever the cost of the drug. But now I pay 10% of drugs for diabetes. The other drugs, I don't pay anything. I don't pay anything. I'm giving those drugs free, except diabetes, where I pay 10%.
You go to pussy with 10%. I'm a lot of money, like 10,000. I'm almost on my pussy. I get time, I was very 1,000 down. And I was my check-up. So, it's in the market, you're going to was less.
The short period we've done this has come out with tremendous results. Testimonies are abound about the acceptance of this scheme by the local community. Everybody is happy with it. They are proud with it, and they are very excited. And I think that in the long term, it's going to go a very, very long way to serving the health needs of the people?
I do advise people, even when people see me having every services, everything free, why them that are paying? They're kind of being jealous and they're asking me about it. I told them it's Avon that is taking care of my bills and everything. Many of them rush to register.
I want many of my friends live like this Avon, so register were very well here. So I wasn't not going to the month. Even serve many of my friends now when I was one the register here.
So my dad says government thing. Am I sure? Say I'm sure. I'm telling you that I'm benefiting. Look at that. This is my receipt. This is what I was billed. But this is what I pay.
Ndị na-aya ahụ na-abịa ụlọ ọgwụ gbologbolо ma ndị ahụ dị ma ndị ahụ adịghị na ha abịa ụlọ ọgwụ gbologbolо ịbịa banye n'otu a ị ga-afụ ezigbote ego ị ga na-enweta ọ na-akwụ mmadụ ụgwọ bili ndị ụlọ ọgwụ unu mara na ọ na-ehi nne ịnọgodo mụọ nwa ị amụ nwa free ihe ọbụla ị na-eme ọ bụrụgodo ọgwụ ọbụla ọ sọrọ gwa dọkịta delu.
My daughter and my son, who are overseas, they are happy. They are happy for lessening their burden of sending me money for medical treatment.